I want to know the story from your perspective. How was the journey? How was the problem and the journey of recovery?
I'm Shannon saying it has been a tough road. Yeah, but we're getting better.
I'm Dr. Pradeep Mahajan, an expert and basic scientist with clinician in regenerative medicine. StemRx Bioscience Smart Technology has a reputation of creating histories in unmet needs of the patient. This patient, Shannon, I still remember first week of March. Maybe I remember as 6th of March. A week before they had a telephonic call with me and a video call with me about her condition. They also sent me all the reports. Fortunately, her mother, Saita, was trying her luck. All the neurophysicians in all the hospitals in Kenya, European countries, with the hope that her daughter, who was with unknown disease as per they felt, was paralytic, loss of power in all the extremities, loss of control of hearing. I went through the reports and expressed a deep confidence to them. They can come to India at StemRx. I was so confident about the diagnosis of mine which was taking place in my mind, which I'll confirm after reports when they came to India. I promised her she will go walking, she will climb the staircase in the flight, and trust me that we could achieve it. The Shannon was full of imbalance of emotion when she came on a stretcher. Her mother, Saita, her eyes were dry, crying and crying and crying. The only hope she was feeling that my young daughter of 17-year-old has to be in the bed for lifetime paralytic. Teenager girl would be in the lifetime in the bed on the stretcher with a bag of urine, unable to move, expressing her grief and deep pains. When I examined her in the first week of March and I fired certain investigations, most of the investigations were coming inconclusive. Clinical examination was showing there was some ailment of autoimmune disease, which I wanted to confirm on investigations. And when one of the tests, that is ANA, came positive, my diagnosis, which I thought before they came, was confirmed as polymyositis, neuromuscular and muscular inflammation caused by autoimmune antibodies. Rest of the things was prepared in my mind about her protocol design, because I knew such patient I have treated earlier on. The journey was very painful, very challenging. Every day I used to face some of the emotional balance of her mother, having big hopes on me now. And the journey was towards the second week of end. The girl started showing movements in the lower extremity and upper extremity, which was a fabulous moment for me. My confidence doubled for the treatment. She walks normal, she talks normal, like as if there was no disease. A wonderful journey from bed to feet, with the challenges of young girl, lost hope to a full hope. So I wish all the best for Shannon for your future. I wish her mother Saita and Shannon a great luck, great future.
I'm Shannon saying I'm 15 years old. It has been a tough road. Yeah, but we're getting better. Okay, so in our school, it's high school, lots of people fake that it's easy to get out of school because it's boarding. So it was hard for me to get out of the situation because the nurse thought I was also faking, so she didn't allow me to go home. So I had a flu for a month and a half. Then she called my mom when it got worse. I was given some medicine, the flu went, and the next day my legs had a problem. Yeah, so it started morning and evening. Then my friends used to help me. I have some nice friends actually. During this situation, I have come to learn I have nice friends that they used to carry me and help me with day-to-day duties. And then when I came in August, we started going to hospitals. I couldn't do a lot of things. I couldn't hang out with my friends. And some of my friends still don't know I'm sick. because I didn't tell anybody because it's not something to be proud of.
But now you can tell that you fought and you won.
Not really. I don't want everybody knowing I was sick. Okay, everybody in our school knows I'm sick, like, because they're helping with fundraising and all, but like not everybody like that I know knows I'm sick. I like drawing. I'm teaching myself how to paint. Yeah, and it's difficult to draw when I have IV on, so yeah. I'm teaching myself how to paint. I'm not that good. I like listening to music. I feel good. Yeah.
My name is Saita. I'm a mother of a 15-year-old girl named Shannon. I reside in Kenya. I am a graphic designer and a social media manager. I'm also a business lady. Came here for treatment for Shannon, who had an ailment that we didn't understand until we got here. That's when we got to know what she was suffering for. Okay, it was a long journey because she started having issues in July last year when she developed a cold allergy that persisted for almost a month or two. She was in Form 1 in Kenya. Form 1 is like grade 9 in high school where she was boarding. So she had gone to a location that's very cold, and she normally gets cold allergies. So they had gone for a while, but they came back. So after having the cold allergy for a long time, I was called by the school nurse who didn't understand why the medication she was giving her weren't working. So I was told to take her to hospital, bring her back. So I did that, and within I think a few hours after she was administered some antihistamine, she stopped coughing. But then later on, like a few hours or the next day, she started numbing legs. That's where the issue started. We didn't understand what was happening. At first I thought it's something that will come and go. So being from Kenya, Africans in our country, we normally first start with the traditional method. So I started with rubbing her legs with the ointment. I was making bone soup, oxtail soup for her, just to strengthen muscles. I knew this is something that will go in a short while. So it didn't work. It was working for a few maybe hours, then coming back. So we continued like that until I was like, no, this must be serious. She has to go to hospital. So we started the journey of going to different hospitals. We were being referred to different specialists. In this case, I was told it could be a nerve issue or a bone issue. We started with neurologists. We went from neurologists to neurosurgeons. From there, we went to pediatrician neurologists. We went to spine surgeons. We went to many doctors. Most of them were not finding what was wrong with her, even after doing different tests. The tests were mainly MRIs, CT scans, nerve conduction tests. She went to so many tests. At this time, the issue was progressing. It was now moving from just numbing legs, because it started happening during morning and evening. But it progressed during the day. She started also developing other issues like pain in her legs at night. We couldn't sleep. I had to turn her like after every 30 minutes in bed. She started having fevers, pain in her trunk area, and she became very hot. Then at times very cold. Then there's a time I could maybe try to pat her with hot water in the legs. She can't feel anything. The sensation was gone. She started having blurry visions in the morning, blood in the stool, neck pain, back pain. There were so many symptoms I didn't understand. Every week there was a new symptom. And every week, like thrice in the same week or 4 times we're in hospital. Every doctor saying a different thing, giving us different medication. Most of them were saying either they don't know or it's psychological. So I was trying to understand how it's psychological because of all the symptoms, It didn't make sense to me. Then they were insisting, because she joined a boarding school that year, she could be having that issue. But I was like, why didn't it come earlier? Like when she joined the first term, why is it coming when it's called second term? And why did it come after the cold, you know? So I had so many questions, although I took her to therapy. Therapy said she's okay. My girl, the way I know her, as her mom and also as a certified counselor, I know when she normally has issues. Yes, she's a teenager, they hide things sometimes from us, but I will know when there's a big issue that happened to her to give her such condition, or maybe for her to become that way. But this wasn't it. This must have been something we were missing, and the doctors weren't ready to admit they don't know. Only one doctor in Kenya said they don't understand this issue. I've never seen something like this. You need to consult somewhere else. So I just happened to come across someone who maybe understands something that could be going on with Shannon, and they introduced me to doctors in India. Then I started doing consultations with them, and there I started getting answers. They started talking of autoimmune diseases, and once I started doing research, the kind of autoimmune they were mentioning then, although they said it's not conclusive until we do the reports and tests from India. So it made so much sense. The symptoms she was getting, all these other things that were coming up with her. But yes, that was the best idea then, but the problem is I didn't have funds to come to India then. So I consulted with my family, with friends, and we decided to start doing fundraising and see how we can get to India and help Shannon, because she was really deteriorating. She could even start having tremors. She couldn't even hold a spoon to eat. She couldn't even hold her phone at some time. Then she could not even climb any stairs. She could not hold a mug to take tea. It became worse. She started now not being able to move, you know. I was washing her, like she couldn't bathe herself. She came from an independent girl to someone who is codependent. So I had to do full-time caregiving. In the process, I lost my job. My bosses weren't understanding why I'm not going to work. Although I was working from home then, but I said it's okay because my daughter comes first at the end of the day. I'm working for her. I have to do anything to help her get back to her normal self. So yes, with the help of my friends, with the help of my family, I got to India. And when we got here is when we started doing tests, the tests from now scratch, and we got the diagnosis, which is polymyositis. They explained is an autoimmune also that causes inflammation in the muscles. The reason why she wasn't able to hold anything with her hand, climb stairs, or even stand. Once she's seated or in one position, she can't move. So after the diagnosis, we immediately started working, trying to get her well. They were doing therapy. They've been doing different kind of treatments, stem cell therapy. There's so many things. Some of them I don't understand, but what I can say, there's so much difference from our country and here, because the zeal the doctors have here is not the same as in our country. They have so much what can I call it? There's so much industrious, there's so much hardworking. They will always want to research what's going on with this girl. Whenever she's not okay, they always come to the room to check, why is Shannon not okay today? What could be the issue? Have you given her this? They're always so concerned about her. I've gotten so much good treatment that we didn't have before, and I think it's a combination of the good rapport, the good atmosphere, plus the medication, the quantum therapy. Even when Shannon is very low, there's a way they motivate her and make her also be motivated to do exercise on her own. So Shannon right now is able to walk. After a month and a week, she's able to now walk. She's able to hold a 1 liter bottle. She's even climbing stairs. She has started being independent, doing a few small things, washing herself, brushing her teeth and all that. I'm feeling so grateful about it. I'm so happy for this journey. It was the best decision I ever made in my life. It was scary coming to a country with limited resources and not sure about the income, because of course I hadn't been to India before, and it was a trial and error, but I'm so glad about the whole decision, the whole journey. The people here are very hospitable, the doctors are very understanding. Everyone has worked so well to make sure her journey is successful, and I can't be more than grateful. I don't know how I'll repay, apart from of course money. Yeah, I am definitely very happy about her recovery.
Shannon is 15 years old. Now, when we evaluated her, we could found that first of all, she has come in stretcher, and we used around 3 to 4 people to make her stand or shift. So that was her condition. Then as we evaluated her, we could found that upper limb the power was around grade 2 plus, but lower limb the power was around grade 1 or 1 plus we could consider. Then the difficulty was when we asked her to walk, she has twisting of her ankle, buckling of her knees. She could not stand for a longer time. Now if we talk about upper limb was having grade around 3 minus, and she was able to do certain tasks, but sitting tolerance was also very low. After certain minute, I think so around 3 to 4 minutes, she could fall back. Sudden fall back was also observed. So this is how the evaluation was, and we could make her stand for a longer time as we wanted to stimulate her joint proprioception. So that was our main goal, and followed by joint position sense. So we used to do different exercises which will stimulate her joint proprioception and positions. That was the thing. And then followed by, we also strengthen her upper limb, her core stability, basically the abdominal muscles and the lower back area. Then this was the condition what we did in the treatment. Followed by, we did all the stretches, and that's how she could gradually able to move from grade 1 plus, which I said for the lower limb, she improved it to grade 3. Then gradually she started completing the full range of movement and went back to grade 4. So that's how she was able to walk, and gradually we started training her with different weights so that she can reach up till grade 5 movement. Now if you can see her video, she is able to walk without support. She is able to play football, she is able to dance, and this is how the balance has been also achieved. So she can perform any task on uneven surface like balancing, where you could realize that playing a football need a lot of balance support, dancing need a lot of balance. So that's how she has coped up with all the things, and that's how the improvement what you are seeing. So we congratulate her for improvement.
Okay, what I'll tell Dr. Mahajan is he's a miracle worker. He's a quasi God. Let me not call him God because he's not God, but God has used him to help Shannon. Not even Shannon, because I've seen other patients here coming with different medical conditions that they didn't have assistance for before, and Dr. Mahajan was able to handle that. I am so grateful for him. I'm so grateful that he went out of his way to figure out what Shannon's problem was. And he's very, very kind and always comes to see her and motivates her all the time. I will definitely recommend anyone who hasn't found answers, especially neurological ones, to come see Dr. Mahajan. Okay, I can definitely say it's not been easy for Shannon, so I'm sure it's not easy for anyone going through the same, because what I understand from even my research, because I've done a lot of research about autoimmune, when doctors don't find a problem, they say it's psychological, and it can become very tormenting to a patient. I'm telling you, there are answers here in this hospital. There are people who understand the situation, the problem, and it's not the end of the world. Just take time, just make sure you consult the right people, and also make sure your mental space is okay, because it can easily make you forget yourself, give up on life, and also maybe not want to maybe recover because you've tried everything and it's not working. So it's not a very easy journey for the patient, but if you get the right doctor, example is Dr. Mahajan, you'll be well and good within no time.